These are the 7 most common mistakes people make when measuring their blood pressure. I've seen even doctors do this, and it can raise your blood pressure artificially. You can look higher than it really is. And I'm actually going to show you, I'm going to demonstrate how to measure it properly. Mistake number 1, you're in the wrong position. The appropriate position to measure blood pressure is sitting down with your back supported. So a chair like this with back that you can lean up against is a good choice. Your legs are supposed to be relaxed. Feet flat on the floor, just crossing the legs can raise the blood pressure by about 7 points. Mistake number 2, the position of the arm makes a huge difference. The arm that you're going to measure is supposed to be at the level of the heart, and specifically the level of the atria, which is the top part of the heart. So it's about the midpoint of the sternum, this bone that comes down the middle of your chest. So about the middle of your chest there, having your arm supported on your lap, for example, raises blood pressure by about 4 points. And if it's dangling on the side of your body, raises blood pressure by about 7 points. A good choice is to prop it up on a table. Now, this table, for example, would be too low for me, right? You see, I want my arm to be about here. So here I would maybe use a pillow to prop it up, or maybe some books, but you want it about this height. You don't want it all the way down here. Does it matter which side, left or right arm you use? There's some controversy about this. Traditionally, we used to always measure left side, but there are some more recent studies that suggest that in people with hypertension, the right side is actually a little bit more sensitive. We can pick it up statistically a little bit more commonly on the right than on the left. So it's a good idea to once in a while measure both sides and kind of have a sense of the difference. Often there's a difference in most people, but it should be small. It should be 5 points or less. If there's a huge difference, 10, 15 points consistently, one side always higher, you want to get that looked at. There could be problems with circulation on that side that explain it. If there's a normal difference, usually around 5 points or a little bit less, if you want to be strict, take the higher value as your real blood pressure. Number 4, it's the wrong time. Wrong timing for measuring blood pressure. Let me know if this has ever happened to you. You come into the doctor's office, you are late, you're out of breath, you're stressed out because there's some important blood work that's going to come up, and you sit down and you're still explaining, what are you doing there, how you been feeling, and the blood pressure cuff comes on and the measurement is pretty early in the visit. Sometimes you're measuring your blood pressure and the conversation is still going. You're explaining, what brings you in today, how you feeling, and the patient is waving their arms around and talking. It's natural to want to say something because that minute of silence is kind of uncomfortable, but that's the right way to do it. The key, the operative word here is at rest. We're supposed to be relaxed, quiet, chill. Not talking, not waving your arms around. Sometimes blood pressure gets taken before you even see the doctor, right? The nurse measures it first thing. If you haven't had time to get to rest, to relax, it'll be artificially high. Or for people who measure their blood pressure at home, we're going to talk about that more in a second. Sometimes we're doing chores, we're walking back and forth, and we remember, okay, let me check my blood pressure, and we sit down and the cuff goes on and we measure right away. That's going to be higher than at rest. What you want to do is sit down, take a couple minutes to relax. If it helps, close your eyes, take a couple of deep breaths. When you feel relaxed and at rest, then you measure. If you've had a big meal and your stomach is full, if your bladder is full, these things can activate your sympathetic nervous system. It's kind of your fight or flight response, and they can raise your blood pressure. So just avoid getting these readings right after a big meal when you're stuffed. Smoking. Smoking a cigarette has an acute, immediate impact on your blood pressure. So it'll be higher if you've just smoked. Now, if you're a regular smoker, that's a fair measurement of your blood pressure a lot of the time. But if you're someone who doesn't smoke almost ever, but you're nervous that day for whatever reason and you just puffed one, just know your blood pressure will be higher than normal. Drinking alcohol can affect your blood pressure. Actually, surprisingly, it can lower your blood pressure acutely in a window of about a few hours. So, good to know as well. Coffee. Caffeine can raise blood pressure, especially people who are not habitual coffee drinkers. In habitual drinkers, this effect tends to go away. They tend to habituate. And this varies person to person, but good to bear in mind as well. If you're stressed out, obviously, if you're worried about something, ironically, if you're worried about the blood pressure being high, that can raise blood pressure a bit. So that's a bit of a catch-22, but just know that if you're very stressed out that day or it's been rough lately, blood pressure may be artificially high. That may not reflect most of your days. On the other hand, this is a little surprising. A salty meal an hour or 2 hours before the reading doesn't seem to have much impact. Several studies have done this, fed participants one meal, higher in salt or lower in salt, doesn't make much of a difference. We're talking about the effect of one meal acutely, right? Overall salt in the diet, yes, has an impact on your blood pressure. Long term, the net effect, but one meal higher in salt before the reading doesn't seem to make a big difference. Number 5, it's the wrong place. Some people have normal blood pressure most of the time, and then when they go to the doctor, in the presence of the doctor or in the hospital environment, their blood pressure goes up. In medical school, we used to call this the white coat syndrome. Normally, this is about 10 points of elevation. In some people, it can be up to 20 or 30 points, so it can be a massive difference. Obviously, this is going to be hard for your doctor to spot because it's always high in his or her presence. But if you're somebody who measures your blood pressure at home, then you know that that's not a normal, it's not a representative value for you. I highly recommend people have a device at home. You can get these for $20 and you can measure your blood pressure at home and have a good idea of what your values normally are. Number 6, the cuff is wrong. There are actually different size cuffs. They're not all the same, so there's different cuffs for different size people. There's cuffs for children and cuffs for smaller adults and cuffs for larger adults. So you want to have a cuff that is appropriate for you. If you're a very small individual or a very large individual, you may need a special cuff. The placement of the cuff, this is very common. People sometimes measure over clothes, right? Ideally, the cuff goes on bare skin. Now, if it's a very thin t-shirt, might not make a big difference. You can try that experiment at home with or without the t-shirt, see how much it changes. But the thicker the clothing, the more this will vary. I've seen people do this with a sweater on and blood pressure comes out 20 points higher than normal and they get scared and then the sweater comes off and the blood pressure like a minute later is way lower. So yeah, that can have a big impact. The position of the cuff on the arm. So the cuff goes on the upper arm, not the forearm, okay, up here. Normally, this depends a little bit on the device. Some have an arrow that points to your artery, and that's here on the inside of your arm. Those that don't, for example, this one doesn't. Normally, this tube should be coming down the front of your forearm in the middle like that. This obviously goes around and straps like that. So the tubing comes down the front of your forearm. If this is turned all the way to the back, or in a different position, there's a good chance the sensor is not in the right place. How tight the cuff is matters. So you obviously don't want to have it super loose because this will be an artificially low blood pressure reading. Also, if it's too tight, like before it inflates, you already have this a stranglehold on your arm where it hurts or you feel your circulation stopping. That's too tight. The reading is going to be artificially high. You want it somewhere in between. You want it snug, but not excessively tight. Because remember, this is going to inflate. It's going to tighten more. But like so, obviously here I'm wearing a long sleeve shirt, but this ideally would go on the bare skin. And it's snug enough that I can get a finger or two in there if I want. But there isn't a huge slack. So that's how you want it. Some people have the wrist monitors. They're okay. They give you the general ballpark. They're a little less accurate, so if you have the choice, go with the arm cuff. Some people can't. They may have some problem with their arms. Of course, in those cases, the wrist is going to give you the general information, but having the choice, go with the arm cuff. Mistake number 7, making a diagnosis after one measurement. So you go into the doctor's office one time, blood pressure is a bit high, you have hypertension. Here's the medication. Sometimes happens. You're supposed to get a couple readings, even in the visit, wait a little bit, measure again, measure the other side, make sure, because as we talked about, all kinds of factors are going to affect your blood pressure. So it could be artificially high by 20, 30 points, even more, right? One day, and it could be completely unrepresentative of your blood pressure 99% of the time. Let's say I confirmed it and my blood pressure is a little high at rest most of the time. How do I get that bad boy down? We have a whole video with 10 tips to lower your blood pressure, and here's the best exercise, simple, quick exercise that lowers your blood pressure dramatically. Check those out. I'll see you in there. Bye-bye.